And we are live. Welcome, everyone, to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co-hosts here at the Melanin Initiative, along with Alicia and Geraldine, who send their love in their absence. In healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share a nursing perspective without taking up too much of your time. We're super excited to continue our series on maternal health. If you haven't already, go back and check out our series on our first episode on maternal health and our second one on doulas. Today, we're joined by Faisa Farole. Did I get that right?
You did.
And she's actually so kind enough. She's going to be on 2 episodes with us. And the first one, we're going to really dive into maternal health and the state of affairs as it is. And she's also going to share with us in her second episode, the Federal Way Birth Center. Before we get started, I want to do a quick little disclaimer. Remember, everyone, this show is for educational purposes only. The opinions expressed here are our opinions alone. They're not a representation of any of our affiliations. If you're experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you're having a physical emergency, you can call 911. And if you or someone you know might be having a mental health emergency, you can call 988. In today's episode, we are going to talk about the state of maternal health for Black and Brown communities. We're going to talk about what our special guest is doing to improve those health outcomes, the education, training, and role of midwives, as well as the education, training, and role of doulas, how these 2 roles come together to improve health outcomes, and how you can find a midwife or doula if you happen to be in the market. Before we jump into our questions, let's get to know our guests a little bit better. Faisa, if you could tell us a little bit about where you're from, your family, and what you do when you're not on podcast.
Yeah, definitely. Thank you so much for having me, Kimberly. It's an honor for me to be here. So I was born in Somalia. My family immigrated to the U.S. In 1993. And so I've known America to be a home for me because I've been here more, longer than I have back home where I was born. So I went through grade school here. I went through high school, college. I have my family here now. I'm a mom of 2. I have 2 boys, 19 and a 14-year-old. And I've, I don't know what else you want me to add. I don't want to jump before your questions.
Yeah, what do you do when you're not on podcast?
What do I do when I'm not on podcast? Oh my God. I am the most productive when I'm busy, like when I have multiple things going on. I just feel like there's just a lot that I can do that I want to do. And so that's what I'm doing. I have a solo midwifery practice that I've been running for about 10 years now. I also am the founder and director of a local nonprofit called Global Perinatal Services, a nonprofit that I'm really, really proud of. We provide doula services and axillary perinatal care like lactation, childbirth ed, free of charge to Black immigrant and refugee families. I really take a lot of pride in changing the landscape of the doula, or birth work in the state of Washington. When I started back in early 2000s, I was one of 2, Black doulas in the state of Washington. And I am happy to report that the landscape is different. It's growing. And I also like to think I have a tiny bit of contribution to that, which is something I'm really proud of. So yeah, that's what I'm doing. I love all things birth. I love seeing, families become families. You know what I mean? Like 2 people become 3. It really, really, and being able to see people that thought that they couldn't go through birth without medication, do it, or people who've had medicated births in the past now try and do community birth, unmedicated. So it's been really awesome just to be part of that journey with the families that I work with. So yeah, and I'm a mom, which is like the greatest role that I have been given. It's something I'm a privilege to be part of. And yeah, I like to have, just have some time with my family whenever I don't have anything going on, and things like that. So yeah, that's me.
That's perfect.
Yeah.
If you could just tell us what all those initials after your name mean.
Yes, sure. So I'm a licensed midwife in the state of Washington. In order for us to bill or practice midwifery, like bill insurances, we have to be licensed. So I'm licensed in the state of Washington. I'm also a certified professional midwife. So that means there is a body called NARM, North American Registered Midwifery. So when you go through accredited schools, you sit for the NARM exam. When you get it, then you get this, the CPM credential behind your name. And then I have a master's degree in maternal child health systems as well. Yeah, those are what they mean.
Were you always passionate about maternal health?
I started doing interpretation when I was young, right? And initially I was just doing interpretation for like family friends, medical interpretation and things like that. But then as I grew older, throughout my high school, I started actually working as an interpreter, medical interpreter. So that sort of allowed me to be, to experience like different medical fields. And because of the modesty that comes with, with the community I was serving, always they would request a female interpreter for labor and delivery. So I got a chance to be in those a lot. And so that gave me this, this like just wanting to pursue a career in that. Initially, what I wanted to do was I've seen a lot of, at the time I didn't even have kids. I was not pregnant. I was not married or anything like that. But I knew birth had to be different. You know what I mean? And so I really wanted, once I got exposed to these different, providers, CNMs, family medicine, OBs, and all that, I really wanted to give my community, a different option of birthing, right? So that's why I pursued a community birth route, because I always tell people that, I knew there was an issue with our maternal, health in this country before like the Seattle Times expose, you know what I mean, and all this stuff, because I was seeing it, right? I was seeing like some of the atrocities that were happening to Black and brown women. And so initially I thought this was something that was exclusive to my community only, right? Because they are refugees, they don't speak the language, all these things. And a lot of times I've seen it, people blaming the women of like why certain things happened, like for instance, Somali women tend to post-date, right? Like they can carry their pregnancy. They tend to carry a pregnancy beyond the 42 weeks, right? And so that was a thing that that the women in the community were getting induced, and then the cesarean section just hiked after that, right? And so initially, because where I'm from, providers know best, right? Like the medical people are trusted 110%. And when they say something, you just fulfill it. So initially, the community was just sort of going with that thought, but the more, it was literally like almost every other Somali first-time mom was getting C-sectioned, or sometimes there would be women who had babies back home, 2-3 babies, and they get here, even sometimes more, they get here and they're, they end up having C-section. So people started to like stop going to the hospital, right? And they'll just call an ambulance when they go into labor. There's been some, pretty bad outcomes as a result of that, because people were fearing to go into the hospital when they medically needed to be in the hospital. Do you know what I mean? But because of this cesarean section, they would stay home and then just call an ambulance, and then they'll be taken to the nearby hospital. And as you know, they don't have medical records of this person. So there was just so much going on that was coming with that. So so that was a piece, and I really wanted to be able to give these women an option to just get them out of the hospital, right? There's even an article that was written by some professors at the University of Washington here. It was published I think 2003, that looked at, if you Google it, you can find it. It's Somali pregnancy adverse outcome or something like that, where they said like Somali women are like 9 times more likely to post-date compared to Black and white American, born women. And so, and that, of course, baby would be, in NICU for quite some time. Women will be objected to go through cesarean because the babies are large. There was just so much stuff that was happening because of this post-dating piece. So that was what sort of had me change my trajectory, because initially I wanted to do an RN degree and then become a labor and delivery nurse and things like that. But when I've also got experience and worked with labor and delivery nurses, so I wanted to do more than just, I wanted to be in that provider role for these women, right? So that was one of the reasons why I went to midwifery, school to become a licensed midwife. And when I finished and I started my own practice, and I just knew from the get-go, once I was done with the schooling, I was going to do a solo practice, just because I wanted to serve the people that look like me. You know what I mean? And throughout my preceptorship, most people that were coming through were middle, upper, wealthy white women. You know what I mean? So that's who I had the privilege of working with, because that's who my preceptors were working with. All of my preceptors were white as well. So I wanted to change that. And I remember also one of my preceptors saying they didn't want to advertise themselves to Medicaid recipient clients, because it doesn't pay much. So, but I knew my clientele was going to be mostly medical, Medicaid recipient clients, and that was okay with me. And so that's how I kind of came to this. And that's why I also from the get-go just wanted to do a solo practice. And when I opened my solo practice, though, it really shifted my clientele shifted real quickly, right? I started getting more and more African-American women coming to me, right? From like some driving as, 2 hours away from my clinic. And then the women from my community, the idea of like having an a community midwife was like, that's something from back home. Like, I'm here now, we're living the American dream. Why do I need to, have a baby outside the hospital? So that was some ideas that the people were grappling, within my community. But then again, I had learned that Somali community was not the only community who was also struggling, right? Like, I would do consultation with African-American women, and I mean, there were so many teary eyes, like, people who've had, experienced hospital birth, like, and one after the other, it was like, it was just traumatic, like it was a lot of like healing was happening just through like my consultation, the first visit and all that. And so my practice sort of picked up. I've had people literally, every time somebody comes to me, I always ask them, how did you find me? And then I've had people tell me, I Googled Black midwife, and at the time there was another midwife before me, but she had retired by the time I started practicing. So I was the only Black community midwife practicing at the time. So yeah, it was, and now 90% or more of my clients are folks who identify as African-American individuals. So it really has been a journey and an amazing one to be able to be served, the people that I serve.
Wow, that was beautiful. And I think you really gave us a really good glimpse of the state of maternal health from when you started to where it's at now. And it definitely sounds like you've had a role in that. And so very commend you for that. 10 years in the game. And even when you were younger, you were really laying the groundwork for what you're doing today.
Yeah, definitely, definitely. Yeah. One of the things that I want to because I hate when, when there's like one of us, in a field or something, and people are like, oh, you're the only one. Like, I shouldn't be the only one. Do you know what I mean? Like, there should be more of me.
Yeah.
So one of the ways I'm trying to change that is, being able to precept other students, right? I've had students graduate from my preceptorship, and I am, I have one student now. I'm going to be interviewing a couple more in the next 2 weeks or so. So it's very important for me, and I give priority to Black, aspiring midwives, because I know um, there isn't a lot of opportunities for them to practice with people who look like them. You know what I mean? And I think it's very important for students to be able to be exposed to the community that eventually that they're going to be serving as well. So.
Wow, your story is amazing. I love education. I'm really big into preceptorship and increasing access to that.
Mhm.
Um, so that preceptorship, so is that like students who are in a graduate program, or anyone? Maybe they're coming from a different specialty. Like, who's I guess, a candidate?
Yeah, yeah. Right now, the one I'm working with, she's on the CNM route, actually. So I'm really um, excited that schools that are training CNMs are also wanting their students to go through and get that community midwife uh, um, training. So she's at Seattle U, I believe, and she's coming through. And unfortunately, she can't, because of their rotation. It's not that long, so she'll be leaving in March. And then I have two students coming through, and they're from Bastyr. So Washington, we're lucky enough to have a midwifery school locally, where people are actually coming from all over to attend. From Canada, there's a lot of Canadian students that come through, and folks from across the state as well. One of the students that graduated from my preceptorship a couple years ago, I think she went to it is an accredited school. I think it's Birthwise is what it's called. I don't think the school is still ineffective, but so yeah, it's folks like coming through from various different, but mainly through an accredited school is the students that I've been able to precept.
Wow, that's awesome. And so, in terms of how long they stay with you, it just depends on their program or their availability.
Yeah, yeah, like the Seattle U one, it's quarterly. Like they have their students move around, and this person actually is staying a little bit more than a quarter because she had asked for. But the other students who are some are going to be like they're just their first year of midwifery school, so and they like to stay on at least you know, 6 months. And then after that, once their, schooling sort of the didactic piece picks up, they want to also like just go along with that. So that way they're in an active practice where they can get more births. So my practice, I do 2 to 3 births a month, and I don't want to do more than that just because I'm also busy with the nonprofit. So and I can also have more time to spend and do educating with the students as well. But there are some students that want to be in a practice that's busier just so that they can get the numbers. So in the state of Washington, we have to have like 100 births to graduate. So at various different levels, right? Like in that observe level, and then I think it's like 20 plus births in the observe level, and then you're assisting, and then you're primarying, some of the births as well. So there's that. There's a newborn, care numbers that students need to have and things like that. Various numbers of like well women checkup that they need to have under their belt as well. So yeah. So there's various different levels the students are like partaking. So yeah.
Oh, that's awesome. And
Mhm.
so you mentioned this word a few times. If you could just explain the difference between you keep saying community birth. Could you just
Mhm.
explain the difference between that? And I guess you're comparing it to hospital birth.
Yeah, yeah. The community births are births that are happening at home or birth centers, right? That's what the community births are. And so because I'm a licensed midwife, the schooling is different, right? So I don't have a jurisdiction at the hospital. I can't deliver babies at the hospital. CNMs can, like certified nurse midwives, right? So because we as community midwives or licensed midwives, we want to direct entry midwifery program schooling. So that is like the difference. And we're not nurses, so we are all about midwifery. So that's why the numbers of the births are higher that's expected for us to have versus like the CNMs. I believe it's like, I don't even know, I think less than 25 births they need to have in order to graduate or something. So yeah, it's all midwifery. And the community thank you for asking me to define that. It's births that are happening in the community vis-a-vis like home or birth centers.
Do you get a lot of questions about that, or a lot of hesitancy about people who are like, oh, thinking the hospital is the one and only way?
Yes, I do. And also more and more people are becoming more educated about what it is that we offer, right? I offer consultation visits before the person comes in so that they know what they are, what kind of care they'll be getting with me, right? And most people who come and do the consultation with me often sign on with me as well because they've already done their homework as far as like what they want and what kind of care they want to get, right? Like, because I make it clear to people that we don't have access to anesthesiologists, so we don't have epidurals like available at all. And then, but our visit dosages are the same as the hospital, right? Like during the prenatal, early prenatal, we see the person once a month. After 28 weeks, twice a month, and then after 36 weekly. So we do the same labs as they would have in the hospital with OBs. So OB care is the same, right? As far as and then we send out for ultrasound if the person wants to, and all that stuff. So, but there are people who are, of course, it's going to be happening, at a birth center or at home. Most birth centers, there is a requirement that they need to be within certain vicinity to the hospital, just in case there's an emergency. And the homes are different because not every home has, is closest to the hospital. So some people are hesitant because of that. But one big thing that folks need to realize is that as community midwives, we don't take anybody. The only people that we can work with are people who are low risk, right? And if at any point the person develops anything that deviates from normal, then they're out of our care, right? Like if their blood pressure shifts and all of a sudden changes, if they develop insulin dependent, diabetes, if they have, seizures or things like that. So all these things are things that, makes somebody high risk, right? So we are really meticulous about making sure, like assessing and making sure that everything is well. And there's a lot of assessment happening during labor and delivery too. So there is the hands-off approach, but medically we still have to, auscultate the fetal heart tones, making sure that mom's vitals are all within normal and all that throughout the labor as well. And so there is a hesitance, but I like this line of work. Trust is so important, between the midwife and the patient. So this is what we try to do during the prenatal phase. Our prenatal visits are half an hour to an hour long, right? And this is because we need to get to know one another. I don't usually take somebody who's like in their last trimester who come to me for care, just because I want to really get to know this person well and what their wishes are. And we talk a lot about this is what to expect. This is what's normal. This is what's not normal, and all those things. So, but still, like the percentage of community births is definitely going up. The pandemic has really, really, pushed it, increased it as well. But still, there are people who are hesitant. And even if the clients are not hesitant, they have family members who are, right? Like there was a birth in November I did. This second time mom, she comes to me, she's had really traumatic experience with her last birth, which happened during the pandemic, right? The height of the pandemic. She wasn't allowed to have many people in the hospital. She had developed preeclampsia. She had developed gestational diabetes and all those things. And they really were badgering her about her baby being large, all these things. She ended up having vacuum extraction, and the baby was 6 pounds, right? Like, she was really like just grieving all that, like the fact that they were assuming all these things were going on. And she felt like a lot of them was not accurate to her truth. So when she came to me, of course, we talked about ways that we can help. This second time around, her blood pressure was great. She didn't have gestation diabetes. We did a lot of nutrition counseling and things like that. And I think the environment really makes a difference too, because when a person comes to us, I don't know if you've ever been to a community midwives clinic. Our clinics are really family centered, right? Like we allow the person to bring whoever they identify as their family to be part of their care as well. And we literally have teas, assorted teas set up. It's really is like a conversation, like you're going to visit your aunt's home or something like that. So I think that attributes a lot to her psyche of like coming to the visit and just being really in that relaxed state of mind. And she ended up having a birth center birth, a really beautiful birth center birth. Her baby was 7 pound plus. And her mother-in-law came, and I was like, this is really cool that everybody's like really supportive of this person. So I went to do her 24-hour home visit, because that's what we do after the births. And I was just chit-chatting with her, checking in how her birth went, how she felt like her birth went and things like that. And she told me that she said pretty much her husband and her mother-in-law were against it, right? Even though everybody looked like everyone was on board when I was there, like everyone was happy and, but she told them that if I don't get what I want, if I don't get this, birth center birth, I'm going to go back to be with my family. Her family was from Sweden. So she was like, I'm going to go back and give birth in Sweden, because in Sweden, midwifery is so well incorporated into the care that it's not this, this weird idea. So, but they were like, okay, stay, you can have your baby at, at the birth center. So, but the mother-in-law was really taken back of how it was and things like that. So a lot of times we're changing the minds of the family members that come with too. Yeah, right. The heroes are the moms who actually decided to do this, but then their family members are able to sort of experience this as well. And I think that's how we normalize it, so not every birth that happens in the community setting is, without any complications. As midwives, we are trained to deal with those should they arrive, right? And if it's out of, if we need higher assistance, then we do call either, 911, or sometimes we travel in the client's own car to go to the hospital and get what we need help with. So yeah, I don't know if that answers. I know it was a long.
No, yeah, actually, I think you did a beautiful job not only giving us the state of affairs, showing how you're improving outcomes personally, the field itself. You gave us a great glimpse into how the education and training is similar and yet different. And you gave really some wonderful examples of how hospital and community birth are quite different, the barriers to providing care, and also how you overcome those barriers and how people's their opinions change once they're able to experience it. And I love that you talked about another country because it's normal in certain places, right? Just because you're not used to it, it doesn't mean people haven't been. It used to be the way it was anyway, right?
Exactly.
And in other places, it's been that way forever, and it's not even a thought. It wouldn't be an argument, like she said. She's like, I can go, and people won't even look at me twice. So I think you did a beautiful job depicting that. You can see your passion for this. So yeah, I think you did wonderful. So I love how you taught me a lot about the difference between the licensed midwife and the nurse practitioner. So I really appreciate that. Do you have doulas working with you?
I do. I have doulas working with me. The nonprofit organization I actually put together, I sort of integrated it into my midwifery practice. So whoever comes through, I tell them about doula services. If they're interested, I connect them, directly to the nonprofit to help provide doula care for that individual. So it really, I love working with doulas. I've worked as a doula. I train doulas, and I think doulas are amazing in gapping. Bringing the gap for pregnant individuals, because it really. I tell people, even though you hired me to do a home birth with you, I still would encourage you to have a doula, right? Because doulas are like somebody who basically is there for the birthing individual. You know what I mean? Like, they can come and help you labor at home before you head out to the birth center, or they can like come in and help you cope in that early, phase of the labor before I even show up, right? Oftentimes I have doulas letting me know how things are going, and when I should head out, and things like that. So doulas are amazing. And often I started off as part of my prerequisite for the midwifery school was I had to go through the doula program, right? That's how I learned actually doulas. And I couldn't believe that this was something that existed and I didn't know about, right? So it was really, really cool. So yeah, doulas are a great addition to any birth work, and I encourage everybody to look into, even if you have family members, right, that are going to be with you. Often the example I give people is like, for instance, you are at you're laboring at a hospital, for instance, and you have a room full of family members, and everybody's there, chit-chatting and everything. Oftentimes they don't know how to put a hand on the woman, how to support, you know what I mean? Like what to sort of do and what she needs. Like, doulas keep in mind that this person needs to empty their bladder, to sort of help the descent of the baby's head. The person needs to stay hydrated, like they keep it like an eye on, like, is she eating anything, like, and all these things, they suggest positions, so doulas are really great addition. And I tell people, you're in a hospital, you get an epidural, the family members are like, okay, I'm going to go take a break now. I'm going to go to the cafeteria. But the doula's role is like to be with you, even if you're not, you know what I mean? Like if you're not in pain. So doulas are great for scheduled C-section. They're great for, scheduled epidural or like whatever scenario you can think of. There's a need. Like, I feel like there should be a doula that will be involved.
Yeah, we love to describe them as advocates in maternal health, and we're really big about advocacy and having someone be there to represent you, right?
Mm-hmm.
Help you navigate that liaison, because we just can't remember everything ourselves.
So true. Yeah, so true. Yeah.
So if someone's in the market for a midwife or a doula, where should they start?
Oh my goodness. So our state of Washington is really progressive when it comes to natural birth and things like that. So we have a bunch of Facebook like pages, right? That anybody who's interested in can tap into just to ask questions about wanting to do this. Our state actually just passed a law a couple of years ago, and we hope that it's going to be implemented next year, where the state will actually reimburse doula services, which is really cool. So yeah, I urge every state to actually, try and ask for such thing, because, doula services is often out of pocket fee. Not every family can afford, and this should be accessible to anybody, who's needing one. And so I think state of Washington is like the fourth state to actually to do this. We have also Bastyr does training, and the trainings are readily available in state of Washington, like if anyone is interested. Same thing with midwifery support services. We have an association locally that people can go, Midwives Association of Washington. People are listed, midwives and the locations they serve. That's another easy way to find. I'm one of the midwives that's listed on there as well. So yeah, there's just a lot of ways to search for one. Just Google it, I would say, for starters, and you'll be surprised sometimes. And like, if you just Google local doulas, what comes up for you as well. Yeah.
Wonderful. And how can people connect with you?
How can people connect with me? Oh my goodness. I'm on social media, even though I'm not I don't post often. Our accountant from her name is Cornisha, with the nonprofit, had tagged me on Facebook weeks ago when there was a coverage of the birth center opening. So she tagged me and she was like, "Girl, you're going viral." I was like, "What?" So I was really surprised. And I think it's, oh my goodness, is it Privity? Something like that. I'm not sure. But the article was just going everywhere. But I'm on social media, Global Midwifery Services, on Instagram, and then also on Facebook. And I think that's it. Those are the two platforms that I'm on at the time.
Wonderful. And we'll put all her information in the description box as well. Oh, we can't thank you enough. And I'm super excited when we have you back to learn more about your birth center. And thank you so much for sharing your time with us. Is there anything else you want to leave the people with?
No, thank you for having me.
Okay, everyone, remember you can email us your questions or show ideas to tmi.melanin@gmail.com. Subscribe to our YouTube channel and follow us on Facebook, TikTok, and Instagram. Please share the show with your friends and rate us on the Apple and Spotify podcast. It really helps support the show and get the message to those who really need to hear it. We release a new show weekly on TMI Tuesdays at 10 a.m. on YouTube and all your favorite podcast apps. Follow, like, and share content with all your friends. Thank you so much, Faisa. It was beautiful hearing your journey. Really grateful to have someone like you out there paving the way for the future, right? You said you can't be the only one. I think that should be a t-shirt. And also just so passionate about improving health outcomes and speaking for those who can't speak for themselves. I think you really depicted that today.
Yeah, thank you.